Hi, everybody. Dr. Ellie Stein here with my video tip of the month for October 2024. This one is called, Does Magnesium Improve Sleep? And the focus is on magnesium threonate. That's spelled Threonate. More on that in a minute. First, some background. People with complex chronic diseases, things like myalgic encephalomyelitis, chronic fatigue syndrome, long COVID, fibromyalgia, environmental sensitivities, and chronic pain, are almost always desperate to get better sleep. Most of us wake unrefreshed, even if we've slept the recommended 7 to 9 hours per night. Now, my definition of unrefreshed is that you wake up feeling much as you did when you went to sleep. You're still tired, fatigued, foggy-headed, have trouble concentrating, don't have enough energy and sometimes motivation to get through the day, and sometimes it's accompanied by low mood. The frustrating thing is that researchers have not yet discovered the telltale markers that identify what makes sleep unrefreshing or non-restorative. Now, if you want to learn more about sleep solutions in general, I refer you to my blog post from September 2022, in which I discuss the pros and cons of sleep medication. To find it, just go to my blog page, type the word sleep in the search engine, and it should pull up. So the next question is, what do people find helpful for sleep? Most people feel they've tried everything and they feel hopeless about getting better sleep. But in years of offering groups in my medical practice for people with sleep problems, I have learned that most people can improve their sleep, even if they have struggled for years. To do this, you need to know what the evidence-based strategies are and how to apply them correctly. Now, just for the purposes of this video tip recording, I've got 8 helpful tips. 1, keep a regular sleep routine. 2, sleep in a dark, quiet, cool environment. 3, develop a routine calming practice like meditation, self-hypnosis, qigong, or something else that you enjoy before bed. Learn and use cognitive behavior therapy for insomnia strategies. It's evidence-based, and it even works in people with physical and mental health diagnoses. Avoid non-native blue light from LED light bulbs and devices after sunset. Avoid foods and medications that interfere with sleep. Unfortunately, this is very individual, so you have to do a lot of trial and error. Try sleep supplements, things like magnesium, which I'm going to discuss more later in this recording. And finally, talk to your medical team about sleep medications. If nothing else has worked, there is a role for them, especially in the complex chronic disease population. Things like zopiclone or zolpidem, sedating antidepressants, and the newer orexin blocking drugs, things like lemborexant and daridorexant. If you want to learn more about these tips and how to apply them effectively, I offer a short, inexpensive self-study sleep course, which teaches you just that. So the next part of this video is why magnesium might benefit sleep in the first place. Magnesium is a mineral that acts as a necessary cofactor in over 300 essential processes in the body. In other words, magnesium is very important. Among these processes, it is needed to help make important neurotransmitters like GABA and glycine that regulate sleep. It's also involved in the production of both serotonin and melatonin. Serotonin generally calms us and helps put us in a good mood, and melatonin actually helps us fall asleep. To learn more about other uses of magnesium, because they are many, you may want to check out my blog post from April 2023. In it, I talk about how to know if you have enough magnesium, how to get more, the different types of magnesium supplements, what they are used for, and then I do a review on using magnesium supplementation for chronic pain. Again, go to my blog page, type in the word magnesium, and it should pull up. Okay, so now we're getting to the topic here. What about magnesium and sleep? And I'm going to share with you some research studies on that topic. To read the references for the papers I'm mentioning here, go to my October 2024 blog post, and I list all the references. So there's two types of studies to look at things like magnesium. The first is population-based studies. This is when researchers look for correlations between things that naturally occur, things like how much magnesium people already take and their quality of sleep. So there's two largish studies looking at this. One is over 3,000 Turkish adults, and they found that people reporting a higher dietary intake of magnesium also reported a higher sleep quality. Now, the problem with population studies is, of course, you don't know what caused what. Did the magnesium improve the sleep, or do people who sleep better have more energy to prepare healthy food with more magnesium in it, right? We can't say. Another study also of more than 3,000 individuals, this time young female dietetic students, found that those who eat more magnesium as part of their diet had an earlier sleep window, so maybe it was helping them fall asleep a little bit sooner. So the population studies are suggestive that a diet higher in magnesium may be helpful for sleep. The second type of study is a clinical trial. That's where you give people the thing in question, in this case, a magnesium supplement. You tell them, please don't change anything else about your diet and lifestyle. And then you see whether there's a change in the outcome of interest, in this case, sleep behavior, like how long are you sleeping and how refreshing is the sleep. So one such study tested 500 milligrams of elemental magnesium, that's a pretty high dose, in elderly adults with insomnia, and they found that those who took the supplement, as opposed to the placebo group, had an increase in their sleep time and sleep efficiency. That means they weren't waking up and lying awake as much. And they did some objective measures, which is a strength of the study. So they increased melatonin level, which one could expect because magnesium is part of that process. But interestingly, it also decreased cortisol levels. So this is what you want. You want to have higher melatonin at night and decreased cortisol. That helps people sleep. Another strength of the study is that they also measured dietary magnesium intake, and it didn't differ between the active group and the placebo group. So they can't, this helps rule out dietary magnesium as a reason for the change. So all is looking good, but as is typically the case in science, not all studies have been positive. A study of older adults with sleep problems and leg cramps were given 900 milligrams a day of magnesium citrate, pretty high dose, and they didn't report any benefit either to sleep or to the leg cramps. Another clinical trial of 100 older adults with poor sleep gave a lower dose, 320 milligrams, also of magnesium citrate, and they reported no change in sleep. So why might this be that the clinical trial results are inconsistent? Is it that magnesium taken in the diet is more effective than when it's taken as a supplement? It's possible. Could it be that the dose was insufficient in the clinical trials? Now, in one or two of them, that may be the case, but in several, the dose looked sufficient to me. Is it that the type of magnesium tested, mostly magnesium citrate, maybe isn't the best type of magnesium to use for sleep. So this is where we get to the interesting topic of a newer sleep supplement called magnesium threonate. Now, threonate is a derivative of vitamin C, and it turns out that when you take magnesium with vitamin C or with threonate, it helps the magnesium cross the blood-brain barrier and get into the brain. Normally, the cerebrospinal fluid regulates magnesium very tightly, and most supplements and even dietary intake doesn't really change the amount of magnesium in the brain. So in this, magnesium threonate seems unique. And it was first discovered in a 2010 study out of MIT. Magnesium threonate was given by mouth to rats, and their magnesium concentration in the brain increased. What's really interesting and got my attention is that this increase in magnesium led to enhanced neuroplasticity, meaning the brain was able to change and learn new things. And this was connected to improved cognitive function in both younger and older rats. Now, I'm not the only one who got interested in this study. Since then, several groups have looked at, well, does magnesium threonate cause similar benefits to cognitive function in humans? Now, there's two studies I'm going to share with you. And before I do that, I do need to mention a significant weakness in the research on magnesium threonate. Most of the studies use a very certain proprietary blend of magnesium threonate, and the studies were funded by the company that makes it. Unfortunately, this introduces bias and means that the results need to be looked at with caution. So one study in 2022 was done in China in relatively healthy 40-something-year-old adults. They tested a combination product, 1.6 milligrams of magnesium threonate, a pretty hefty dose, in combination with a molecule called phosphatidylserine. Now, phosphatidylserine is a naturally occurring component of our cell membranes. It's thought to be especially important in the brain, and used alone, even without magnesium, supports and benefits cognitive function. They also included vitamin B6, vitamin C, and vitamin D3, all of which assist magnesium to get across the blood-brain barrier and then to work effectively once the magnesium is in the brain. Now, they gave their subjects 5 memory tests, and they found that after 30 days of using the magnesium threonate combo product, there were very significant improvements in all 5 memory tests. So it shows that the two things together, the magnesium plus the additional products, probably work synergistically to result in very impressive improvements. But what it doesn't show is, would magnesium threonate result in these benefits when used alone? So finally, we're getting to sleep, what you've all been waiting for. A recently published trial of middle-aged adults with self-reported sleep problems were given magnesium threonate by itself, 1 gram per night, and sleep was objectively measured with Oura rings. There were improvements in virtually all of the measures of the Oura ring, including REM sleep, rapid eye movement, deep sleep, and readiness. Readiness on the Oura ring is a measure of heart rate variability. There were also improvements in subjective measures of daytime mood, energy, and productivity. So there were both objective and subjective measures. The weakness of this study is that they looked at a gazillion measures. And unfortunately, when you look at so many, a certain number are going to be positive just by chance alone. In addition to cognitive function and sleep, magnesium threonate is thought to decrease oxidative stress in the brain and it's being tested in animal models to see whether this may help protect the animals against dementia. Now, a couple of studies were done in humans, and a 2024 meta-analysis reports that unfortunately the data is not yet there to draw conclusions about whether magnesium of any kind, including threonate, improves cognitive health in humans. The last section of this video is my personal experience and conclusions. As you know, I am a guinea pig at your service, and I try most things I read about long before I discuss them or recommend them to others. So a few years ago, when I first started hearing the hype about magnesium threonate, and I got my mind around the hefty price tag of this proprietary supplement, I decided to try the exact brand in the exact dose that's recommended from the studies, and I did it for 3 months. I noticed nothing, not for sleep, not for leg cramps, or any other symptoms. Now, since then, the price has come down, but it's still much higher than any other form of magnesium. So you can expect to pay about $45 Canadian, not including shipping, for 90 capsules, and the recommended dose is 3 capsules a day to get the equivalent of 150 milligrams of elemental magnesium. Elemental means that's the mass of the magnesium alone, not including the threonate. Now, in conclusion, magnesium is a very important mineral in our bodies, facilitating over 300 biochemical processes. That's a lot. Unfortunately, getting enough magnesium in our diet is difficult because of the poor soil makeup that grows most of our food, and because many people take other drugs and supplements that actually impair magnesium absorption. Now, although magnesium supplements are widely used for sleep, my review suggests that it remains unclear whether they improve sleep or not. There definitely is a signal, especially in the population-based studies, but we need to know a lot more, like who is it going to help and for what types of sleep problems. However, given the low cost and high margin of safety, I would say if you've never tried magnesium before, or your health has changed and you think you might respond differently now, magnesium is worth a try. The worst that can happen is you get some loose stools, not a disaster. You just pull back on the dose and the situation should improve. Now, regarding magnesium threonate in particular, with the combination of those other molecules, phosphatidylserine B6, vitamin C, and D3, it does seem to help the brain. And if you can afford the price tag, you might want to try it for 3 months. If you see nothing in that time, I would stop it and move on to something else. Now, if you've already tried magnesium threonate or decide to try it after watching this video, I would love to hear your experience. Does it live up to your expectations? Thanks for your interest in the topic of magnesium, magnesium threonate, and sleep. I look forward to your comments and suggestions for future topics. Please comment below. Please subscribe to the YouTube channel to help me get more curated, science-based health information out there for people in the complex chronic disease community.